One of the most common misconceptions that women have is that they're too young to be in perimenopause. And the truth of that is, perimenopause can start as early as your late 30s. The common things that women will experience when they're first entering this hormone shift are things like insomnia or new anxiety or weight gain, fatigue. So there's this whole cluster of things that send women to their doctor, and often they'll come away with a prescription for antidepressants and anti-anxiety medications or birth control pills. And what really is underneath as the root cause is a hormone imbalance because they're not making enough progesterone anymore.
All right. Hello and welcome to this episode of the Freedom Seekers Show, the place where we have unfiltered conversations that matter to you, women. I'm your host, Yvonne Winkler, CEO of Lotus Consulting, Inc., an organization on a mission to support women's well-being through empowerment, harmony, and collaboration. And today we have an incredible guest with us, Dr. Anna Garrett. Dr. Anna has dedicated over 25 years of her life as a clinical pharmacist. And along the way, she discovered her true passion, which is working with women in midlife. Dr. Anna uses a functional approach in her practice, which includes hormone balancing, weight loss, gut health, and health coaching. Her programs are all designed to help women in perimenopause and menopause escape from hormone hell, feel amazing in their bodies so they can rock their mojo through midlife and beyond. Yeah. She's also passionate about teaching women how to advocate for themselves in the healthcare system. And Dr. Anna is a certified intrinsic coach and a bar master certified coach. And in 2019, she published her first book, Perimenopause, The Savvy Sister's Guide to Hormone Harmony. Dr. Anna lives in the beautiful mountains of Asheville, North Carolina. Welcome, Dr. Anna.
Thank you. I'm so happy to be here with you.
We're thrilled to have you. Let's begin with debunking some of the misconceptions around perimenopause and perhaps even menopause. Like, when does it start? What are some of the more common symptoms?
So, yeah, this is a great way to start. So one of the most common misconceptions that women have is that they're too young to be in perimenopause. And the truth of that is, perimenopause can start as early as your late 30s. And it begins kind of insidious isn't the right word I'm looking for, but it can look like a lot of things. So, um, common things that women will experience when they're first entering this hormone shift are things like insomnia or new anxiety or weight gain, fatigue. So there's this whole cluster of things that send women to their doctor, and often they'll come away with a prescription for antidepressants and anti-anxiety medications or birth control pills. And what really is underneath as the root cause is a hormone imbalance because they're not making enough progesterone anymore.
Yes, that was. I have to refer back to your book because this is how you got onto this show in the first place. I was so taken by this book. I think this is a book every woman in her mid-30s and up needs to read. Um, and I just love your sense of humor in this. Just the way you're, because, like, I mean, the first chapter is, what is this new hell? And that is exactly how I felt. I
You're
was
not alone.
yes, and that was what this book gave me, was to know that I'm not crazy, I'm not losing my mind, and that I'm not alone. Um, One of the symptoms that you didn't mention, but that I really resonated with, was the Well, you mentioned insomnia, but also the night sweats and
Ah,
and the smell. I was like, you have one of them is like, what is this stink? And it was that. I had never been a person that had a problem with BO. And all of a sudden I was like, oh my God, like what is going on? Like, do I need to change my deodorant? Like, have I gotten too used to it? You know? So I really, really appreciated you writing this book and giving us a glimpse of what perimenopause looks like and what what we can do about it. So let's dive into that. You use a functional approach in your practice, which includes the hormone balancing and then weight loss and gut health and health coaching, of course. Can you tell us a little bit more about your three-pronged approach to helping
Sure.
clients manage symptoms in perimenopause?
Sure. So, the foundation of my approach is always lifestyle change because unless you're addressing your lifestyle, especially stress, you are not going to achieve the results that you want more than likely. So, I tell people they can't supplement their way out of a crappy lifestyle. So, when I say crappy lifestyle, I mean crappy food, stress, and exposure to toxins, which are everywhere. And some of those are hard to avoid, but you can go on a scavenger hunt in your house and kind of start weeding things out. So we get that in place. We set some goals. So I've worked with people for a minimum of 6 months because it takes that long, really, to get them with some momentum and really understanding what's going on and achieving what they want to achieve. So that's the first step. Then the second step is working with supplements. So I try as much as I can to work with herbal supplements and natural approaches. Um, Part of that is because I have a lot of clients who we'll talk about hormone therapy, I'm sure, but I have a lot of clients who would prefer not to go that route. And I also can't write prescriptions for things. So I have to work with my toolbox, which includes anything that's over the counter. Well, over the counter, except in Canada, you can get actually estrogen and progesterone. So there's a lot of things out there that we have access to that can make a big difference. But I mean, simple supplements like magnesium glycinate. I mean, that's like number one on my list for if you're having insomnia, you need to be taking this because a lot of us are, depleted in magnesium because of the quality of our food. And then the third step is hormone replacement therapy. So I do a lot of work with over the counter progesterone because women in perimenopause tend not to need estrogen because they're flooded with it, which is part of the problem. But we do use progesterone cream to help balance out those estrogen levels. If they are closer to menopause, then the issue may be low estrogen, and there are a number of estrogen containing products over the counter that can be had. And I will just throw in right here, I don't think estrogen replacement is a good do it yourself project because you can screw that up. Progesterone is a pretty low risk option, but I would never suggest that anybody start ordering up estrogen products and doing that themselves, especially if they don't know where their levels are.
Yeah, you mentioned that a lot in the book. Is
Mhm.
you keep referring back to get tested, get a handle on what your hormone imbalances are, so that you can treat it properly and not mess that up even more. One question I have for you that just arose um, is around stress. Like when you said your first prong is the lifestyle change, and stress, I I speak for myself, has certainly been a big component of my life, especially in these last few years. And I was very fascinated to read how progesterone and cortisol are interrelated in terms of this perimenopausal effect. Can you tell us a little bit more about that? Because I can't repeat it the way you wrote it.
So there's a couple of issues. So the first is if your cortisol is high. So cortisol is one of your stress hormones for your listeners that might not know that. Um, and when you're under a lot of stress, your body produces cortisol constantly, and it, it causes all kinds of problems. So it causes elevations in blood sugar, and it causes breakdown of your body tissues over a long period of time. But the what you're referring to is cortisol can actually sit in progesterone receptors. So even if you have enough progesterone on board, it's not going to be able to do its job because the cortisol has blocked that receptor in your body. So that's the first problem.
And this is for extended periods of stress, right?
Yes.
Yeah.
Um, yeah, because I mean, if you look at, let's say, an animal, I used to talk about my dog. When the UPS man came to the door, the dog would, even if he was sound asleep, jump up and go just bark like crazy and just "Rrr," as soon as the guy left, back to sleep.
Mhm.
And so that's how stress is supposed to be. We're supposed to have some stress because we need that to deal with our daily activities, to get deadlines met, to have some get up and go. And so that is not a bad thing. It's a bad thing if you don't ever have any stress. So they're equal. They're two sides of the same coin.
Yeah.
But what we don't want is just this unrelenting stress that most of us now tell ourselves is normal. But your body sings a different song.
Mhm.
And so you may be able to mount a high cortisol response, but eventually the communication between your brain and your body breaks down, and you end up with what's known as, incorrectly, adrenal fatigue, which is really just a miscommunication between your brain and your adrenal glands. Your adrenals aren't weak, and they don't peter out. Uh, but so that's a problem.
Mhm.
And that happens over a long period of time. The second problem that can happen is that cortisol is the only hormone that your body needs to live, and so it will take progesterone and turn it into cortisol. And everything comes from pregnenolone, and then there's progesterone, and then there's cortisol underneath that. So your body can take the progesterone and make cortisol. And over here on the other side is estrogen and testosterone and DHEA. So your body will make the cortisol at the expense of all your other hormones. So I'm seeing more and more clients now who are just depleted of hormones across the board, and they're 42 years old, and it's like, what is going on? And almost invariably it's stress.
Yeah.
um, and that's not a good thing. That contributes to all kinds of chronic diseases like diabetes and depression and osteoporosis, and just on and on.
Yeah.
And people don't understand what stress management actually means, and it's different for everybody because we all relax in different ways, but it's so important.
So important. I wholeheartedly agree. I because it does have so many trickle effects, and it works its way into all these different areas in our lives. This one, and I mean, sleep being one of them. And you talk lots about sleep and the function of sleep, be whether it was for weight loss or for regulating hormonal function. Um, there are a lot of myths and misconceptions surrounding hormone replacement, as you said earlier already. Um, could you shed some light on the truths and dispel some of those myths for our
Sure.
listeners?
So there's probably two I want to talk about. So the first one is, many doctors will say, "Oh, you shouldn't test your hormones because they're changing throughout the day and it's not of value." And I'm like, mm. So what that usually means to me is that they don't know what to do with the results that they get. And it is true, your hormones are changing all throughout the day. But guess what? So is your blood sugar, and we use that to make clinical decisions on. So that argument holds no water with me whatsoever. So I am not necessarily, when I'm working with a client, looking at the absolute numbers that come from the hormone testing. I'm looking to see the relationship of them to each other. So if somebody has really high estrogen and really low progesterone, it is highly unlikely that at some point during the day they're going to have some sort of progesterone surge that's going to balance that out. Um, what is true is that women who are in early perimenopause may ovulate some months and make quite a bit of progesterone and may not ovulate other months. And so for my younger clients, I'll often have them do an ovulation predictor kit so we can try to catch that progesterone at its highest if there is progesterone produced. So, uh, that's my workaround for people who are kind of on the fence. My older clients who are skipping periods all the time, there's just no point in doing that, and it's just a step that creates a delay in helping them feel better. So I don't do that with my older clients. The other myth I wanted to talk about is about estrogen.
Mhm.
So there is still a lot of fear around using estrogen, and oh, it's dangerous, or it's going to cause you to get cancer. And I want to talk about that a little bit at length, if that's okay. So in 2002, there was a study done. It was called the Women's Health Initiative, and that was 20 some years ago, and we're still operating off of the thinking that came out of that. So women were divided into two groups. One group had a uterus, the other group did not. The people who had had hysterectomies got estrogen alone. The women who still had a uterus got estrogen and a synthetic progestin, which is not progesterone, it is synthetic. Progesterone is bioidentical, and they didn't look at that. Um, and the study was designed to look at the effects of hormone replacement on brain health, bone health, and cardiovascular health, as well as cancer risk. And what happened was the group that got the combined therapy with the synthetics had more cases of breast cancer. And so they stopped the study early. Well, the media latched onto this, and suddenly the headlines were estrogen causes cancer. Millions and millions of women were ripped off their hormones immediately, which is a very bad idea, if in case anybody's wondering, because your symptoms will come back with a vengeance if you do that. So it needs to be tapered. But over the years, they have done sub analyses of the data that came out of that. And what they found was that the women was that the synthetic progestin was actually the problem. So that is the piece that contributes to an increased risk of breast cancer. And it's a small risk, but it's not zero.
Mhm.
And they've actually done studies since then with IUDs that have progestins in them, as well as birth control pills. And the same finding popped up. So we know now that the synthetic progestins are the problem child in this picture. And there's a whole body of evidence that's, I mean, we already know about the benefits for bone health of using estrogen. There's a body of evidence that's looking at dementia, and the results are a little conflicting, but it's sort of like, well, why wouldn't estrogen help prevent dementia in women? I mean, it's a hormone that we have for years and years and years of our lives. Why would it cause breast cancer? I mean, it just doesn't make any sense.
Right.
Um, so there's two books I'd like to recommend to your listeners if they want to really, dive into the details. So the first is called XX Brain, and it's written by a woman named Lisa Mosconi. I don't remember what her training is. I want to say she's a psychologist, but I could be wrong about that. And it looks at the importance of estrogen in women's brains over the entire lifespan, from puberty all the way through menopause. And then the second one is called Estrogen Matters, and it's written by a physician named Avril, Avril Blum, Blum, and it looks at all the data on breast cancer, bone health, brain health, and cardiovascular health. And it's a little dense if you're not a medical person, but I think it's still worth reading if you have discomfort around, is this a good option for me or not?
Mhm. Well, and I'm going to add a third book to it, and that is Perimenopause.
Well, of course. I
It's
mean,
a sister guide to hormone harmony, not hormone therapy, but hormone harmony. I love that word. And to your point, like for some of us who really aren't physicians or trained in the medical field, who have very little insights into what studies were done or what this hormone does and what this amino acid does, this
mhm.
book I found incredibly helpful, because you list it in a way that makes sense. It's understandable and it's not overcomplicated. And you can see by the thickness, it's not a monster of a read either. It's easy to get through. In fact, I got through most of it on a ferry wait, going leaving the island. So um, thank you for clarifying that. Another aspect that you mentioned is the role of gut health and
Mhm.
hormone imbalance. Could you explain the connection between the two?
Absolutely. So most of your neurotransmitters like dopamine and serotonin, which are some of your feel good chemicals that keep you from being depressed, they do all kinds of things, are made in your gut. And so, if your gut health is poor, then your neurotransmitters may be low. And then another piece, I mean, there's a lot of pieces to this, and I'm not going to talk about all of them. I'm just going to talk about the ones that need to be sort of top of mind.
Mm-hmm.
Um, there is an enzyme called beta glucuronidase that's made by some of your gut bacteria, and it can, so estrogen goes through a couple of phases to be broken down. It gets packaged up in a little bow, gets tied on it, and you ultimately eliminate it in bowel movements. So if your beta glucuronidase is high, it can untie that little bow in your gut and it will allow estrogen to recirculate and create more metabolites that may be dangerous. So there's one in particular that can contribute to DNA damage, and increase your risk of cancer if it's not detoxified. So you've got the beta glucuronidase that's in phase two of estrogen breakdown. And then phase three is your bowel movement. So if you're constipated, you are going to recirculate your estrogen as well. And you have to fix those in reverse order. So the constipation comes first, then phase two, and then any phase one, which happens in your liver defects that there may happen to be. So, it can, your gut can really play havoc with how well you eliminate your estrogen, as well as causing issues with neurotransmitters, which can result in anxiety and depression and insomnia. So I recently made a change to my 6 month program. I mean, I have a couple of 6 month options, but my flagship program actually looks at hormones and gut health, and we take that information and put it all together.
Mm. Thank you. And let's talk about your program in a minute, because I would like to also give the listeners an opportunity to connect with you um, past this interview. Um, one more question for you. It was very clear to me in the book, but also in our pre-interview conversation, that you're very passionate about empowering women to advocate for themselves within the healthcare system. What are some of the key takeaways and strategies that you can share with our listeners for doing that?
Um, well, the first strategy would be, so reading something like my book that's fairly simple and approachable, to give yourself a baseline knowledge of what is going on with your body. Because if you don't have that, it's really hard to have an intelligent conversation with your healthcare provider about it. And I don't think I put this in the book, but I may have. But I have a blog post on my website about it, how to advocate for yourself in the healthcare system. And so I have a whole list of 10 things that you need to think about before you see your healthcare provider. So, what do you want for yourself? Are you willing to entertain the idea of hormone replacement or not? Um, what are your lines in the sand as far as lifestyle changes? I mean, if somebody told me I could never have another glass of wine, I'd be like, I'm not doing that. So it's good to have to know yourself and have an understanding of what you're willing to do. If your healthcare provider dismisses you, which actually happens quite a bit, don't stop looking because there is help out there. I mean, there's people like me. I'm not an MD, but I know pretty much about drugs and, how to handle hormones. And so there are alternate practitioners like chiropractors or naturopaths or pharmacists who can help you out of whatever situation that you're in. So be willing to think a little more widely if your doctor dismisses you. And we I don't do this, but it happens a lot, like in Facebook groups. People start bashing doctors about, "Hey, they're not helping me at all." Well, here's the thing. Most doctors don't get any training in how to manage hormones, and it's not their fault. Um, I don't know exactly how the Canadian system is. I know it's very different than ours, but our average patient visit is supposed to be about 7 minutes. And, when your doctor's standing there with their hand on the doorknob, getting ready to walk out the door, you can't have a conversation about hormone health in 7 minutes under the best circumstances, which is why writing a prescription for birth control or antidepressants or anxiety meds is the easiest thing to do because it gets you out the door. Um,
Yeah, I don't think it's much different in Canada in that
okay.
respect either. Yeah.
Well, your naturopaths can do a little bit more than the ones in most states in the United States can do. So most of them can't prescribe in the United States.
So how would someone like me who, other than reading some materials, how would I distinguish between, I mean, my doctor, let's say my doctor dismissed me. How would I distinguish if the next person I'm going to and they're in a healthcare profession, pardon me, in a holistic profession, so naturopath, for example, that they know what they're talking about?
So, what I tell people to do is call their local compounding pharmacy and find out who knows what they're doing because the pharmacist will know.
Oh, okay. That's interesting. Okay.
Yeah,
Yeah. Okay. That's really good. That's
because they work very closely together.
mhm.
And a lot of times, physicians will just hand patients off to the pharmacist to do, the prescribing under a protocol or whatever. But yeah, the compounding pharmacists usually know who in the community actually has a clue about what they're doing.
Yeah. Yeah. Is there like certain trainings or whatnot that someone can look out for as well? Because you said doctors aren't trained on hormone therapy.
Yeah, there are many in the US at least. There are okay, not gonna say many. I know of at least three in-depth training programs that physicians can attend. They've got to pay for it on their own. They've got to have um, some desire to really get uh, into that kind of work. When we think OBGYNs, oh, they should know all about hormones. Well, they don't. So uh, it just takes some desire to uh, obtain specific training for hormone replacement. And really, a physician's bread and butter, depending on what practice they're in, like endocrinologists. People ask me about endocrinologists all the time. Should I go see them for my hormones? And I'm like, no. Unless you have diabetes or thyroid disease, you need to just skip it because you're going to come away and you're going to be very disappointed. Um, so I tell people to look for a functional practitioner. In Canada, there are plenty of naturopaths that are pretty well trained. There's there's a friend of mine. Her name's Shirley Weir, and she runs a menopause support group in Canada. She lives in Vancouver. Uh, Menopause Chicks is the name of it.
Okay.
Um, and so she can help people get connected with a naturopath in Canada. She also has a nurse on her site that does some sort of consultations in Canada. So,
Oh, that's really great. Thank you for all those tips, Dr. Anna.
mhm,
That's it's really powerful suggestions. And let's circle back to your programs because you have, as I said earlier, you have several programs
I
that
do.
focus on menopause and perimenopause. Um, how can someone get in touch with you and learn more about them?
So they're on my website, first of all, dranagarrett.com, and I'm assuming you're going to put that in the show notes.
I will.
Um, the best first step is to, I mean, I've had people buy my program right off the website. So that's not my favorite way to do it, but it works. But my favorite way to do it is to have somebody schedule a consultation with me, or my team. So there's three of us that work together. Um, and it's not free, but you come away, it's 45 minutes. You come away with, suggestions if you want to just do it on your own, or we can talk about the in-depth programs. So it's $297 US, and that is called a Let's Talk call. It is also on my website. So as soon as you sign up for it, you get a link to my calendar, and off we go.
Yeah, so that seems to be a really good first step to, to consult
Yes.
with you as to where am I at in the spectrum of perimenopause and menopause, and what can you recommend for me to maybe look into?
Right, and it also gives me a chance to, talk to somebody and find out if I think we would be a good fit for each other, because there are some people who I feel might be better served by like a therapist or somebody else. And I don't want somebody to, buy into one of my packages if I can't be the one, to help them feel better.
Help them. Yeah, oh, that is so big of you, Dr. Anna Garrett. That is fantastic. And I want to just say thank you so much for agreeing to come on to the Freedom Seeker
Oh, yeah,
Show.
you're welcome.
Our listeners are women, usually in their mid 30s to and 40s and beyond, um, who have either been through this or are going through this very thing right now. And so I really appreciate you sharing your wisdom with us. And maybe we can have you back sometime and
I'd
we can
love
talk
to.
more. And for now, though, I would like to say thank you and take good care. And we will talk to you soon again.
Okay, thanks for having me.